Time for Hot Picks, and we are zeroing in on the small cap pharma sector. Our guest top pick is United Therapeutics. He believes this company could double its sales with a new drug targeting lung disease. We're joined by Terry Smith, a director of life sciences research at Emerald Advisors. Thanks very much indeed for coming on the show. Tell us about your first name. What exactly is United Therapeutics targeting?
Yeah, so United Therapeutics, they're a company, they're a $20 billion market cap. They have several drugs for lung conditions, but they have one that's most interesting. It's called Tyvaso. Tyvaso is an inhaled drug. It's approved for two indications already, but they recently had phase 3 data in something called idiopathic pulmonary fibrosis. This is IPF. It's a terrible lung disease. Patients generally live 4 or 5 years with this disease. There were two drugs approved about a decade ago for this disease, and they each did over $1 billion in sales. The drugs weren't well tolerated. They weren't taken for very long, but we believe Tyvaso can be a gigantic drug in this space, maybe $3 to $4 billion in peak sales if when they get approved. They have one phase 3 already in hand. They'll have the second phase 3 reading out in the next 2 or 3 months. It's highly likely to work, and we believe this could result in a doubling of sales. The stock trades at about 16 times GAAP EPS this year, and we think that's not very expensive when you consider the long runway they have ahead of them.
So they already have some profits?
They're already quite profitable right now.
Next company sounds really interesting, Axsome. They're working on a drug for major depressive disorder. It's actually been approved, but also they hope it'll show promise in Alzheimer's disease.
Yes, Axsome is a company that's on the cusp of profitability. They have a drug called Auvelity. It's approved for major depressive disorder, and it did about $500 to $600 million in sales last year. It's growing north of 50% a year. They're going to continue to grow in MDD, but the attractive thing is they have recently been given the green light by FDA to submit their application for Alzheimer's disease agitation. Alzheimer's disease agitation is, of course, in patients with Alzheimer's disease. There's only one drug approved in the United States right now with ADA. We believe this will be the second, and this will be further inflection in sales. Right now, looking at 50% growth in MDD alone, adding in another indication would be terrific for this. The nice thing about Auvelity is that they have date certainty on when there will be a generic. It's not until 2039, 13 years from now. This is the type of thing that Big Pharma loves to acquire when they have long visibility, multiple indications. Axsome also has a pipeline that they claim is $16 billion in peak sales. That's probably not probability adjusted. I don't think we're going to pencil in $16 billion in peak sales for this, for a $10 billion market cap, but they have a strong pipeline in addition to Auvelity growing really well.
I see. So it's not actually an Alzheimer's treatment. It treats that side effect of or
agitation
effect
associated with Alzheimer's. Yes.
Right. And it's interesting. Axsome is a combination of two drugs, including bupropion, which is a well-established antidepressant drug.
It is. They developed this drug, and they actually had to show that it was better than the two independent components of the drug. And in the beginning, doctors were a little skeptical. Oh, maybe I could just use two generics and it would work the same. It's shown time and again that it isn't. There's a special thing about this formulation that makes this drug work better than the two individual components that it's made of.
And then tell us about your final company, Mirum. You say it's just turning profitable, and it might look expensive at around 9 times sales.
Yeah, Mirum is one of the best management teams in the small and mid-cap pharmaceutical space. They have a tremendous pipeline. They've been growing very well for the last several years. You can see the stock has done quite well, all on the back of a single drug called Livmarli. Livmarli is approved for 2 rare indications right now for liver diseases. They're about to have a third study that's kind of a basket study, studying a variety of liver diseases to get a third group of patients on drug. But what really has me excited about this company is a second drug that's targeting 2 liver diseases. One is called primary biliary cholangitis, and one is called primary sclerosing cholangitis, PBC and PSC. There's nothing approved for PSC. It'll have phase 3 data reading out in probably the April-May timeframe. The company says that these two drugs in aggregate could be $1 billion in sales. I believe they could each be $1 billion in sales. And they're doing a really neat thing with the PSC trial. Nothing's been approved by FDA because FDA hasn't been able to agree on what are the short endpoints people need. FDA wants to see things like liver failure or liver transplant. Those trials take forever. As a result, no one's been able to get anything across the goal line. Mirum has done a really smart thing. These patients have tremendous itch, like want to rip your skin off itch. So they're actually going to treat itch associated with PBC and PSC, which is a clear read into patients' quality of life. Patients have really good compliance when they have something that is affecting the symptoms of their disease. Mirum also recently acquired a company called Blue Jay that is making a drug for hepatitis Delta. We believe that's going to have a phase 3 that's also a positive readout this summer. So we're looking at 3 or 4 positive phase 3 readouts in the next year on top of an already profitable base business.
We'd better jump. Thanks very much, Terry. Those are 3 fresh names.
Thank you.
Terry Smith, Director of Life Sciences Research at Emerald Advisors.